I thought it might be helpful to show you a typical case study of a patient who presents with atrial fibrillation and heart failure. This is a fairly typical scenario. So in this instance, it's a 75-year-old man who gradually noticed over a period of weeks, probably months when he looked back, that it was getting more difficult to walk. And so he started driving short distances that he used to walk. He got a bit more fatigue on his general activities, showering, changing, walking upstairs or inclines, walking on the flat, making a bed, sweeping, vacuuming, that kind of thing. So he started doing less and declining more outings. And he got a little bit of swelling in his legs and feet, such that his shoes felt a bit tight. So he would change to more comfortable footwear. He also noticed a bit of weight gain over the last 3 or 4 weeks, and he put that down to being less active. And he subsequently ended up in hospital. And we did a few tests on him. Now, an electrocardiogram gives you the electrical signaling of the heart, and in the normal case, it should look like this, where you've got really nice, normal, stable, regular activity. At rest, it's about 60 or 70 beats per minute. But his looked more like this, where you get rapid, chaotic, irregular heart beating, and it's quite all over the place, quite chaotic. A normal chest x-ray, when you have a look at the heart and lungs, should look like this. You've got this nice, easy to see heart silhouette. You've got the diaphragms at the bottom, really clearly outlined, and the dark spaces that you see are where the lungs are. With an x-ray, you should be able to see that things that are like air will be dark, and things that are bony or fluid filled or a more solid tissue will come up as white. So you see lots of air in his lungs and clearly defined structures as a result. But his x-ray looked like this. You can see it's very different. There's a lot of fluffy white stuff where the dark shadows of the lungs should be, and we've lost that nice border of the heart and the nice border of the diaphragm sitting under at the bottom of the lungs. And this is a bad sign, and it shows and represents a lot of fluffy opacity in the x-ray, which is fluid sitting in the air spaces, a bit like water contained in a sponge. So this is not good, and we need to get rid of this. So what now? Well, looking back, he probably had gained at least 5 or 6 kilograms in the last few weeks. With treatment, and in particular fluid tablets or diuretics, he lost actually 12 kilograms of weight, and that equates to 12 litres of water, because 1 kilogram of weight will be the same as 1 litre of water. And we're talking about rapid weight loss or rapid weight gain here. And this can only be water. It cannot be muscle gain or loss or fat, because that takes a lot more time. He needed oxygen initially and monitoring in a heart unit. And once he lost the fluid in his lungs and they cleared, he was then able to breathe a lot better. He noticed he could walk more freely. His shoes fit more comfortably. He could lie down flat at night without feeling really scared that he wouldn't be able to breathe properly. And our goal is to send him home set up with daily weight monitoring at home, tracking his water intake or total fluid intake and restricting it to 1.5 litres, taking his medication as instructed regularly, which both preserves the current situation and protect his heart in the long term, and also with the warning signs of what to watch out for if he's getting into trouble. For example, early weight gain would be one way that we would know he's getting into trouble, and some increasing breathlessness or fatigue. So hopefully this helps you understand a little bit more about how we see and what we do to manage a patient with atrial fibrillation and heart failure.